Thanks, Nabu, for the opportunity to share today. Happy Friday, everyone. My name is Kim Moore, and I am the IT Application Specialist for Ottawa County Department of Public Health here in beautiful Holland, Michigan. We are a local health department serving a population of just over 300,000 residents, and our department currently employs 113 public health champions. We were fortunate enough to be able to bring most of our executive leadership to NACHO 360 this year. And when we returned, two of the biggest takeaways for our group were that, one, we wanted to integrate more AI into our processes to improve the well-being of our staff. And then two, we needed an AI policy like yesterday. So we knew we had a handful of folks using paid subscriptions to AI models like ChatGPT. And we knew that inevitably there were team members who were using free versions of similar tools, or individuals we didn't know were using tools at all, but sure enough were. But we had no scaffolding or monitoring or training for any acceptable use of any of it. So some of the things that we know it's regularly being used for includes things like revising emails, summarizing meeting notes, transcribing meetings, writing SQL code and Excel formulas. I'm probably the most guilty of that. Some data analysis, analyzing and rewriting surveys to improve the reading level, assisting and leading to a clinical diagnosis, lots of uses. And hearing those uses and knowing we had no guidance for staff was a little bit unnerving. We hadn't provided any training. We didn't know if staff understood what a learning model was or if they were verifying that the response that AI had provided was accurate. Some of those were pretty no or low risk queries, like getting assistance writing an Excel formula. But as the risk goes up to suddenly things like assisting in identifying a complicated diagnosis, we knew we had to have some way of safeguarding our client data while still allowing staff to access this pretty incredible technology. And moreover, because both the access to AI for general use has become so readily available, and also that the technology is continuing to evolve daily, we knew the need for a policy creation was immediate, but it was also going to be complicated. Our IT infrastructure, like many of yours, is managed at a county level. And so we started by reaching out to our county IT to see if they had already had an AI policy or if one was in the works. It wasn't. Then we reached out to some of our local nearby health departments and within our Michigan local health department networks to see if anybody had developed a policy. They hadn't, but they were interested in learning more if we found someone who had. So we really didn't know where to start, and we didn't feel knowledgeable enough in AI technology to build a policy ourselves from ground zero, which circled us back to the experts that we met at NACHO 360 from F&T Labs. So we were able to work with Nabu. We assembled a team of decision makers and enthusiastic AI adopters to determine what was most important to us. And we determined that for us, that meant staff education and data security. Another huge advantage to working with F&T was that they were all from the public health sector. So they understood the constraints in budget and time and the requisition requirements, and were able to work with us to meet all of those constraints. And finally, they took the time to review the policies we already had to ensure that we were identifying those that would touch on adjacent topics. So things like information security, HIPAA, acceptable use policies. And Nabu was also able to use those policies as a template. So this new policy was ready to be published immediately, which sounds like a small thing, but it meant it was another step that I didn't have to complete before we could adopt it. And that's a great thing, because that's part of the problem is we don't have enough time already, and adding these extra steps in is difficult. So it was such an easy process for us that netted a pretty substantial deliverable. And we are finalizing the adoption of it next week and figuring out the true nuts and bolts of what it looks like to implement with our team. So now that we have a policy written, it's also opened us up the opportunity for us to think bigger and consider how we can leverage AI to do some of those tasks that a computer can do, so our staff can focus their time on those tasks that a computer can't. So we're so grateful that we were able to lean on the expertise of the F&T Labs team to write the policy, but also for the responsiveness to our questions about the next steps, like educational materials and ensuring the AI tools we're using are as secure as we can make them. Your staff are absolutely using AI tools, whether you realize it or not. So this is a chance for us to be proactive. I encourage you to develop a policy to provide them with clear guidelines of use that protect them, your organization, and the individuals that you serve. So Nabu and Juliana, thanks for the opportunity to share our journey.